All it takes is one bad decision to change your life. Imagine a guy that has 3 children and a loving wife. He works 55 hours a week to support his family. He's the cornerstone of his community, always hosting barbecues and things like that. But he starts to develop really severe back pain from all the hours that he works. And his doctor won't do anything for him. He doesn't see an issue and won't help him. But one of his friends tells him that he can drive across the state, get medical marijuana, come back, and it solves all of his issues. He goes back to being the perfect father. But one time, during the trip, a cop pulls him over, and he goes to federal prison for 6 years. 6 years. His life is ruined. He can't raise his family anymore. He can't support them. It's obvious that something needs to change here. But what? Today, I'm going to be talking about a project that has ruined countless lives, destroyed a lot of communities, has been a huge waste of money, packed our prisons full. This is called the war on drugs. A lot of people, when they think of dangerous things, they think of cancer or car accidents. But today, I'm talking about drugs, which are just as scary. In an article by Ronald Moss, it's found that around 115 people die per day from opioids. Imagine that. During one of our lectures, that's 5 of us just gone. And that's not all. In an article by Mabazi Karisa, that is estimated to be just a fraction of the deaths that happen every day. In 2017, it was found that 13,942 people died from cocaine alone, and 10,333 died from other psychostimulants. That's thousands more than needed to die. But why, you might ask? Aren't these drugs illegal? And the answer is yes, but it doesn't matter. The Controlled Substance Act, passed in 1971, aimed to make these drugs illegal based on a couple different things, but the research at the time was not very good, and it basically stopped research into these drugs entirely. Additionally, these drugs are still easily available. This exact point is mentioned in an article by Brandon Del Pozo, where he said that prescription drug use is actually on the rise despite all of these laws. Also, illegality equals danger. For a lot of these drugs, when they're made illegal, illegal corporations take over. And because illegal corporations want to make drugs as potent as possible for easy transportation, it makes it that much deadlier for the user. Also, this allows people who still do drugs to have connections with people, and they might get recommended something else. For certain drugs, they have deadly withdrawals, and people might try to make substitutions to help themselves out to get through these. And this can also be dangerous. This is mentioned in an article by Megan Rowe, where she said that substitutions are dangerous territory. And there can also be other bad effects that happen. In an article by Rebecca McKetton, she found that methamphetamine use leads to a 5 times increase in crime. And these people might not even know what they're buying. They're just trying to get through their sickness and their withdrawal. But why might people use drugs in the first place? Well, one of the factors is stress. It's the same as like alcohol and tobacco. A lot of these people use these drugs even though they know the short-term and long-term effects. And even families are advertised these drugs all the time. Despite that, people still use them. In an article by Daniel Cabral, he cites that drug use and stress are closely linked. And exercise and things like this can actually be used to mitigate that stress, but a lot of people still turn to drugs because of their immediate action. And also, prescriptions. Prescriptions can also lead people into drug use. A lot of these people, their first experience with a drug is from a trusted medical professional. In an article by Kavita Babu, she found that someone who prescribed opioids for a short-term operation was 44% more likely to still be using opioids a year later versus someone who was never introduced to them. And these are people who trusted their doctor and trusted their decision, and they might lead into an addiction from it. I'm not here to justify drug use, but I am here to talk about a public health crisis that we need to address. There's 2 things that we can do to help out. Number 1, we need to turn this from a legal issue into a medical issue. These people need help. They're sick. They don't need prison. They need care and support. In countries that have changed their policy and gone for a more medical-based approach, they've actually seen great effects. They've seen less overdoses. They've seen less drug use overall. They've spent less money on healthcare, and actually crime has gone down. And imagine other substances like this. When my grandma got sick with cancer, we didn't throw her in prison. She got help. She got a healthcare plan developed for her, and she received love and support to help get through it, along with the health plan. Something else that can help solve this is complete legalization. If we legalize drugs all the way, or at least decriminalize them, people can get drugs from a trusted source. They know exactly what they're buying. It's not mixed with anything. It's an exact amount, and doctors can track this. They can give them advice. They can give them that care and support, and they can make sure if they're doing something dangerous, they can get extra advice on it. We've also found that use goes down, and this would also open up research again. People can finally research into these drugs, why people use them, and how we can help their addictions. We can all help to change this problem. The first thing we can do is volunteer. Places like Salvation Army are so important for these people who've had their lives ruined from drugs. For only an hour a week or 30 minutes a week, you can turn people's lives. And also, we need to make change politically. We have to make our voices heard because policy change happens through politics. With a 5-second Google search and your location, you can find out who represents you. You'll get a picture of them, their address, their email, and a phone number. Let them know what you think, and so that they can make policy decisions based off of that. Think about that. How many people have you heard contacting the representative? Nobody. I can't do this alone, but I and your fellow Americans need your help. You're now aware of one of the biggest issues our world faces that no one wants to talk about. You're aware of the reality that so many people face, the effects of these modern drug laws, and solutions, possible solutions to the problem. You also know what you can do to help out. We can fix this and make lasting, permanent change. But to do that, we have to put in our passion and attention to it. If we don't, nothing is going to happen. We can end this public health crisis. I and the future Americans and your children will thank you. Every day, lives are being lost. We have no time to waste. But unfortunately today, like too many other days, is going to be the day that over 100 lives and people's lights go out. Thank you.